Today, we're diving deep into a condition that affects many people, often impairing daily activities and causing significant discomfort. We're talking about frozen shoulder, medically known as adhesive capsulitis. Frozen shoulder is a condition characterized by stiffness and pain in the shoulder joint, restricting its movement. This condition typically develops gradually and can take months or even years to resolve. The exact cause of frozen shoulder isn't completely understood, but it often arises after an injury or surgery that leads to a period of immobilization. Conditions such as diabetes, thyroid disorders, and heart disease have also been linked to an increased risk of developing frozen shoulder. Although anyone can experience this condition, it is more common in middle-aged individuals and women, particularly between the ages of 40 and 60. Frozen shoulder progresses through 3 distinct stages. First, there's the freezing stage, which can last from 6 weeks to 9 months. During this stage, shoulder pain starts to develop, making it increasingly difficult to move the shoulder. The pain can become more intense at night, disrupting sleep and daily activities. Next, we have the frozen stage, which can last from 4 to 6 months. During this period, the shoulder may become stiffer, with a significant reduction in the range of motion. Interestingly, while the pain may gradually decrease, the stiffness remains. This is the most challenging phase, as even simple movements can become problematic. The final stage is the thawing stage, which can last anywhere from 6 months to 2 years. In this phase, the range of motion begins to improve gradually, and shoulder function returns to normal over time. However, it may not always resolve completely, and some individuals experience residual stiffness. Diagnosis of frozen shoulder typically involves a thorough medical history and physical examination. Your healthcare provider will likely assess the range of motion in your shoulder and may order imaging tests like X-rays or MRI to rule out other conditions. It's important to distinguish frozen shoulder from other shoulder issues, such as rotator cuff injuries or arthritis, to determine the most effective treatment plan. When it comes to treatment, early intervention is key. Mild cases of frozen shoulder may resolve on their own with time and physical therapy, which focuses on improving the range of motion and strengthening the surrounding muscles. Your healthcare provider may recommend specific exercises to gradually regain shoulder function. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can also help manage discomfort. In more severe cases, corticosteroid injections may be recommended to reduce inflammation and alleviate pain. For those who do not respond to conservative treatments, more invasive options like shoulder manipulation or surgery might be considered. Shoulder manipulation involves a doctor moving the shoulder while the patient is under anesthesia to help break up the stiffness in the joint capsule. Surgery, usually arthroscopic, is performed to remove scar tissue and adhesions, allowing for better shoulder movement. Now, prevention is always better than cure. While it may not be entirely possible to prevent frozen shoulder, taking proactive measures can help reduce your risk. If you're recovering from surgery or an injury, try to follow your rehabilitation plan closely and avoid prolonged immobilization of the shoulder. Regular stretching and strengthening exercises can also help maintain shoulder flexibility and strength. In summary, frozen shoulder is a debilitating condition that can significantly impact your quality of life. It progresses through 3 stages: freezing, frozen, and thawing. Understanding this condition and seeking early treatment can help you regain functionality more quickly. If you suspect you might have frozen shoulder or are experiencing persistent shoulder pain, don't hesitate to consult a healthcare professional for a proper evaluation and tailored treatment plan. Thanks for joining us in this discussion on frozen shoulder. Be sure to like, share, and subscribe for more informative content on health and wellness.